Imagine this: a patient comes to the emergency room after sleeping with his arm hanging over the chair or after the party. The next morning, he can't extend his wrist, his hand just drops down. What happened? This classic condition is called the wrist drop, and the nerve responsible is the powerful radial nerve. But don't worry, in the next 5 minutes, you will master the radial nerve from its origin, course, branches, motor supply, sensory supply, and all the high end clinical correlations using simple diagrams and easy memory tricks. By the end of this video, you will never forget why radial nerve injury causes the wrist drop, and you will be the exam ready for the MBBS and university exams and NEET PG. So grab your notebook and let's simplify the radial nerve. Made easy. The radial nerve it is the branch of the posterior cord of the brachial plexus, thickest branch in the brachial plexus, and its root value is all segments in the brachial plexus involved, that are the C5 to C8 and T1 segments. Course in the axilla. Radial nerve descends behind the third part of the axillary artery and upper part of the brachial artery. It lies anterior to muscles forming posterior wall of axilla, that is the subscapularis, latissimus dorsi, and teres major. At this level, radial nerve gives branch to the medial head of the triceps, then it enters in the lower triangular space between the teres major and long head of triceps brachii and shaft of the humerus. Here gives the two branches, that the branch to the long head of triceps brachii and posterior cutaneous nerve of arm that supplies the skin along the posterior surface of upper arm. Then in the radial sulcus of the humerus, there is the radial nerve enters through the lower triangular space into radial sulcus, and in radial sulcus it lies between the lateral and medial head of the triceps brachii along with the profunda brachii vessels. It leaves the sulcus by piercing lateral intermuscular septum and enters to the anterior compartment of arm. You have seen in last video that the ulnar nerve pierces the intermuscular septum and enters to posterior compartment, and radial nerve is just opposite to that. It piercing lateral intermuscular septum and enter to the anterior compartment of arm and give branches to the lateral head of triceps brachii and medial head of triceps brachii. And second muscle is the anconeus muscle, and their branches are the posterior cutaneous nerve of forearm, lower lateral cutaneous nerve of arm, vascular branch of the profunda brachial artery. Then in the front of the arm, lateral side of the arm, radial nerve descends on the lower and lateral side of the front of the arm deep in the internal between brachialis medially and brachioradialis with extensor carpi radialis to reach capitulum of the humerus. Here it gives the three muscular branches, branch to brachioradialis, extensor carpi radialis longus, and brachialis muscle. In the cubital fossa, the nerve enters the lateral side of the cubital fossa. Here the radial nerve terminates by dividing into deep branch and superficial branch. Posterior interosseous nerve is the deep branch and superficial branch is superficial radial nerve. It gives branches to muscles, then it goes between two heads of supinator muscles to reach the back of the forearm. Two muscular branches, that are the branches to extensor carpi radialis brevis and a branch to supinator muscle. In the forearm, superficial radial nerve, it leaves the cubital fossa to enter the lateral side of the forearm, accompanied by the radial vessels in its upper 2/3. Next, in the lower 1/3, superficial radial nerve turns laterally to reach posterolateral aspect of the forearm. It descends till anatomical snuff box to reach dorsum of the hand, where it supplies skin of the lateral half of the dorsum of the hand, skin of the lateral 2.5 digits till distal interphalangeal joints. Then the posterior interosseous nerve, it enters the back of the forearm, where it supplies 7 extensor muscles of the forearm. It then descends and passes through fourth compartment under the extensor retinaculum to reach back of the wrist, where it enters in the pseudoganglion. Here is the important branch of the radial nerve, that is the posterior interosseous nerve. It features the chief nerve of the back of the forearm, and its branch to radial nerve gives of cubital fossa, just below the level of the lateral epicondyle of the humerus. Course. begins in cubital fossa, passes through supinator muscle to reach back of the forearm by passing two planes of fibers of the supinator muscle. Ends in pseudoganglion in the fourth compartment of extensor retinaculum. And its relations are: it enters back of the forearm by passing between two planes of fibers of supinator. It emerges from supinator on back of the forearm. It lies between superficial and deep muscles at the lower border of extensor pollicis brevis. It passes deep to the extensor pollicis longus. Then it runs on posterior surface of interosseous membrane up to the wrist, and where it enlarges into pseudoganglion. Then its branches. Muscular branches are there, that the piercing of the supinator before extensor carpi radialis brevis and supinator, and before the supinator muscles, and the piercing the supinator, that supinator branch, and after the supinator extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris branches. And two long branches are there, lateral and medial. Lateral gives to the adductor pollicis longus and extensor pollicis brevis, and medial gives the extensor pollicis longus and extensor indicis. Articular branches are there, that supplies joints, that wrist joint, distal radial ulnar joint, intercarpal and intermetacarpal joint. Sensory branches to the interosseous membrane, radius and ulna. This is the diagram for the radial nerve course. In the axilla, here gives two branches to the medial head and long head of the triceps brachii. Then lateral branch, lateral head of the triceps brachii, then lower cutaneous nerve of arm, posterior cutaneous nerve of arm. Here is the anconeus muscle, and in the arm it gives brachialis, brachioradialis, extensor carpi radialis longus, and in the superficial, in the forearm there is superficial branch and deep branch. Superficial means the deep means the posterior interosseous nerve, and these are the muscles in our hand. In forearm, not the hand, forearm muscles are there, and it ends in the pseudoganglion. And the clinical anatomy is the most important. Saturday night palsy, sleeping in armchair with the limb hanging by the side of chair, also called as crutch palsy. Fractures of the shaft of the humerus results in weakness and loss of power of extension at wrist. Sensory loss over narrow strip of the back of the forearm and on the lateral side of the dorsum of hand. And the next is the wrist drop. No synergistic actions of the extensor, hence doesn't have the grip. These are the clinicals. This is the diagram. These are the branches, course, relations. And radial nerve is over now. If you like it, share, like and subscribe. And finally we will see the diagram for the radial nerve supplies to the from behind this part of the hand, from the dorsal side, and in the ventral side so little, but in the dorsal, the main nerve for the dorsal supply of the hand.